It is now the second day of the rollout of COVID-19 vaccines to the elderly here in South Africa. The country is aiming to vaccinate 5 million citizens older than 60 by the end of June. So what is the situation on the ground this morning? Let's head over to senior reporter Aviwe Mtila in Polokwane for us this morning. Hello to you, Aviwe. 48 hours in, phase 2 of the vaccine rollout. What's it looking like in the province of Limpopo?
It's been a busy morning at the Pietersburg Hospital in Polokwane as a lot of excited elderly people come through. It's day one at the Pietersburg Hospital, but in Limpopo overall, it's the second day of the second phase of the COVID-19 rollout. A lot of people that are excited about it, in fact, and a lot of prominent people that are coming through, Gareth. We spoke to the South African Council of Churches chairperson here just after he got his jab, and he said he's excited that he's feeling normal, no side effects, and in fact, egging on some of his congregants to come and get that jab. We also spoke to the House of Traditional Leaders, Hosi, who did say that they're now in talks with the MEC to get the distribution even in the rural villages. We understand in Limpopo there are 6 hospitals that are earmarked currently, but conversations are ongoing to get deeper into those rural villages. But also, it's the elderly people, of course, Gareth, that we've been having conversations with, detailing how they've been navigating through the COVID-19 pandemic, staying to those strict protocols and regulations, and now how elated they are that it's finally reaching them as well. Let's just listen to some of those voices.
I'm very happy, very, very happy. I realized that this pandemic is very, very serious. I had 2 cases in my family, but through following all the rules and the instructions that we got from the TV, from the media, from the doctors, we know what is the meaning of vaccination. We know what is the meaning of sanitizing, social distancing, and the importance of putting on the mask. So, fortunately enough, my daughters who were affected, who tested positive, they really quarantined us, followed all the rules.
And we were also speaking to the province's health MEC earlier, weren't you, as far as in terms of the provincial target? Where do we sit today?
Well, for the elderly, the target is around 500,000 elderly people that need to be vaccinated within the second phase, but the broader target is 1.6 million people that will be vaccinated by November in Limpopo. I put it to the MEC that it's a bit of an ambitious target, given that they didn't reach their phase 1 target, which is around 50,000 healthcare workers to be vaccinated. They managed to reach some 33,000, but the MEC said that it's a lengthy target, given that the vaccination is up till the end of November, and in fact it will incorporate the other essential workers, which include doctors, policemen on the front line, teachers, and various other essential workers. But just listen on that conversation I had with MEC Dr. Popira Matuba.
When we said 500,000, we are referring to the above 60. So phase 2 vaccination is not only talking about the above 60, it's also talking about essential workers, which includes your police, your teachers. It also includes those with comorbidities. It also includes people in congregated settings, like your prisoners, like your old age home. So the total number of phase 2 vaccination comes to around 1.66 million estimation. And
isn't that an ambitious target, though, MEC, given that phase 1 targets weren't met in terms of vaccinating the healthcare workers?
If we want to meet the 67 target, the herd immunity, we must really deal with the real statistics. Yes, our target for the healthcare workers, inclusive of the private practitioners, was at 59,000. Remember, when we vaccinated the healthcare workers, it was not the rollout plan by the National Department of Health. We were participating in the phase 3B clinical trial of Sisonke. Hence, we were not in control of how the processes run in the vaccine.
All right, Viwe, before I let you go this morning, seeing all the chairs and everyone sitting on those social distancing chairs with their masks on, I had a conversation with the health minister last week asking about the practicalities of let's call them the more experienced population here in South Africa, the over 60s, some of those will need assistance from family members as well. What does it look like, the layout of where you are? Are there a lot of people who are requiring assistance from loved ones, or are people on the ground, the officials, able to assist them? It's a concern from many family members. How do I let my 90-year-old grandmother go and stand in the sun for hours on end?
Well, it's happening both ways, Gareth. We see family members coming here, accompanying the elderly here, some of them in wheelchairs, but we also see a lot of officials that are helping them and assisting them in that process. It talks to the conversation I had with the Khosi, the leader of the House of Traditional Leaders. You would understand at the moment there are around 6 hospitals where the vaccinations are being rolled out, but it's a bit tricky for the deeper rural villages. And in fact, that's the conversation that the Khosi mentioned that they're having with the MEC in terms of even utilizing some of the offices of the Houses of Traditional Leaders, which will make it much easier for the elderly to travel shorter distances to these vaccination points. But here on the ground, they are being assisted both by their family members as well as the officials that are on the ground. This is in fact the first point where they get registered, just to confirm that they have been registered, and then they go on to move onto the actual vaccination sites. And you can see everything has been done in terms of trying to keep them even away from the sun, on the shade, as they wait for that process to continue. But it's not a long process in its entirety. At around 30 minutes at the most that the elderly will have to spend as they get those vaccinations, Gareth.
I think it's one of the first times we've actually had a time frame of how long people are sitting in these queues everywhere. I think very helpful for families watching you and I talk now about how long it's taking to get there, get to the process, get the jab, and then get home. So that's good to hear. Some 30 minutes, maybe a bit over. Let's talk quickly. I'm not sure if you've had a chance to speak to anybody today, but I know it's questions you've asked before about the registration for the vaccination, more from a technical perspective. People who are sending in the SMSs to register, they're meant to get another SMS back confirming, and then another SMS to say, yes, you need to come through on such and such a day. I'm seeing a number of articles and social media posts of people saying it isn't working. What is the sense you're getting, or that you have gotten, perhaps from people there today, or since you've been covering this the past few days?
Well, those messages, I've actually been shown some of them where once you arrive here, you get that message that tells you that you have been registered on the National Department of Health electronic vaccine data system, and you'll be contacted via SMS in terms of the next steps that need to happen. But once you're here, you essentially go in there, they verify that you are ready and checked, and then you go through to where the vaccination actually happens. Once you've been then registered and you've received your vaccine, you then receive another SMS which details the date that you received the vaccine and the actual vaccination center that you received it from. It then goes on to give you your proof of vaccination code that you need to keep safe should you be required to verify your vaccination status. You understand that this is the first jab of the Pfizer vaccine that you receive on the ground and on the day. You then detail, there's a card in fact that you're even given that will detail your next appointment. Some of them, the people that have been receiving the vaccines today, they're told to come back on around the 8th of June and the 9th of June, some of the dates that the elderly have shown me on the cards there. So it's approximately just roughly a couple of days wait, around a month wait, where you're expected to then come back for your second dose of the Pfizer vaccines, the ones that are currently being rolled out on phase 2 in Limpopo.
All right, also very important information. Thanks, our senior reporter, Viwe Mtile. So the wait time, roughly just over half an hour, it seems, at that particular vaccination centre in Limpopo, and also those who get the first jab about a month later having to come back for the second jab due to it being the Pfizer vaccine in this particular case. Back to Viwe later in the day.